process of porcelain veneers, let's get started. So the first thing we want to do is make sure your mouth is healthy, you're a good candidate for the veneers or crowns, like let's call it a smile makeover, because you could do it with crowns, you could do it with veneers, you could do it with bridges, implants, all types of restorations. But basically, once we know that the patient is healthy and a good candidate, what we do is we take impressions of what their teeth currently look like. So you can see here, the teeth are really bulky. So this is the crowns this patient already had. They're very bulky and bulbous, and they actually don't really fit her face good. So what we do is we always look at the patient from the outside in, meaning what are the boundaries of their face? How does their lip fall when they smile? What kind of personality do they have? What colors are within their skin tone that will match, what shades of white and gray and pinks that we put into all the restorations that we do. So we analyze, the patient's facial structures, where their lip is, where their bone is, and all of that. And then we have to position the teeth within the boundaries of the face in order to enhance their smile and make their smile look aesthetically pleasing. So one of the first steps we do is we take what's called wax up impressions. So we take impressions of their mouth, how that currently is, and then we create a wax mold of what potentially the end result will look like. We have the patient analyze this. Sometimes we can even try this in on the patient. They get to trial their smile. And then once the patient okays this, we go to work. We have to, for this patient, we had to take off all the crowns that she already had, and we make her temporaries. These temporaries last about 2 to 3 weeks, and then she comes in about 2 weeks later, and we have the permanents ready.